creating an identity of success takes time. It's necessary to seek quality in every detail. The work must have doses of boldness and responsibility. And in the midst of so many equals, it's necessary to be different. Thus, a leader is born. EMS. A 100% Brazilian company, leader for the past 5 consecutive years. Almost 50 years of history. Units in Hortolândia, in the metropolitan region of Campinas, and São Bernardo do Campo in the greater São Paulo area. And 3 new plants will go into operation: Jaguariúna, Manaus, and Brasília. A huge company and with even a larger mission: to produce quality drugs at fair prices to assure millions of people access to health care. EMS manufactures medical prescription medicines, over-the-counter medicines, generic drugs, hospital line drugs, and brand medicines for different medical specialties. It ranks first in the pharmaceutical industry. For every 100 drugs marketed in Brazil, 11 are from EMS, which has tripled its billings in 5 years. A brand approved by physicians and patients. It all started with a small pharmacy that grew along with Brazil. The year 1964 marks the official founding of EMS, and in the beginning of the 70s, the first headquarters was built. The industrial complex of Hortolândia, one of the country's largest plants, was inaugurated at the turn of the century. A specialized team and good manufacturing practices guarantee the quality of EMS's products. Developed and manufactured medicines are marketed in Brazil and exported to more than 30 countries in Latin America, Africa, Asia, the Middle East, and Europe, including the UK, which has one of the most demanding regulations in the world. EMS holds all the quality certificates in the productive process, including the one from the European Medicine Agency, EMEA. It also develops research in partnership with the most renowned Brazilian universities. For more than 5 years, it has maintained a technical scientific agreement with the Italian Laboratorio Monte Research, and more recently, has closed technology transference deals with Cuba and China. A priority for the company, the Research and Development Department is allocated with significant investments every year. This policy consolidates the brand and guarantees that EMS is one of the 7 largest pharmaceutical industries in Latin America. More than 200 medical researchers and new technologies endow speed and innovation in the launching of new and important products. Currently, EMS has 61 proprietary patents granted by several countries, including the United States. EMS, the first in Brazil to manufacture generic drugs. Soon after their patents broke, we were the first to launch sildenafil, atorvastatin, olanzapine, and valsartan. Such pioneering nature represented a savings of almost 50% in the Brazilian citizen's pocket. The first Brazilian pharmaceutical country to export to Europe. The first to produce high-complexity generic drugs for transplant patients. Among the drugs registered by the Brazilian Health Surveillance Agency, 50% are from EMS. EMS's daily challenge is to promote the well-being of its employees and community. The Emiliano Sanchez Daycare Center, founded in 2008, serves almost 300 children, including those of employees and local inhabitants. EMS also advances education and sponsors artistic and cultural projects. EMS. Almost 50 years dedicated to people's health. Proud to be Brazilian.